Hello everyone, myself Dr. Priyanka and I'm one of the StudyMRCPI mentors. We are conducting the OMR series which will definitely help in your MRCPI OSCE exam preparation. And today we'll be doing an important station for the exam which is Molar Pregnancy station. Do like and subscribe Study Medic YouTube channel and also press the bell button icon. Thank you. So do remember that the future depends on what you do today. So today we will be doing the case and Dr. Somya will be my examiner and I will be the candidate for the exam.
Yeah, hi Priya, good to see you. So let's, as always, guys, molar pregnancy is one of the very easy scoring stations. So let's start, and we are going to keep a timer. As you guys know, there is no reading time. Yes, Priya, you can start.
Hello, I'm Priyanka and I'm one of the exam candidates. I have read the scenario and I'm ready for the discussion.
Okay, hi Priya. Dear, can you please summarize the case for me?
Yeah, she is a case of hyperemesis gravidarum. She's 9 weeks and has come with complaints of excessive vomiting to the early pregnancy assessment unit.
Okay. What additional information you want to gather?
First, I want to know her severity of vomiting, and if she is really dehydrated and has excessive vomiting, I would like to offer her first antiemetics and would like to settle her down. And then further in her history, I want to know since how many times per day she has vomiting. Does she has any? Is she able to take liquids or does she have vomiting even on taking liquids also? If there is any history of hemoptysis, any abdominal pain, lower abdominal pain, or any bleeding or spotting for vagina. And then in the also I want to ask her if there is any history of burning micturition because that can UTI can also cause like hyperemesis. And in the obstetric history, I want to know if she is a primary gravida or if she has any previous history of twins or molar pregnancy. Her present medical history, if she has any gastrointestinal problems, any previous history of surgeries, her cervical smear history, any family history of twins, and her blood group, and any reservations for blood transfusion is important because if she requires any surgical management, so knowing the blood group and if she's Jehovah's Witness is important. Any allergies, I want to know about that. Then coming to the examination, I want to do a specific head-to-toe examination. I want to look for the any pallor or any weight loss, any tachycardia, any signs of dehydration, and also I would like to do a VT-RIS assessment, upper abdominal examination to look for any enlarged uterus because that can be seen in the twins and the molar pregnancy. Any signs of thyrotoxicosis I would like to know about.
Okay. So this is she's actually second gravida in her 9 weeks, and she has her PUQ score is 13 now, and she's a bit dehydrated as well. Apart from that, she's like unable to get on any of the fluids, and she had a spotting around a week before, and she's getting a spotting every day from then onwards. And she is not allergic to any medications, and no history of twins anybody in the family. The previous child was a normal delivery, and it is 3 years old, as well as her BMI. Okay, on examination, she looks dehydrated, and her examination, it looks like per abdominal examination, it is 12 weeks of gravid size uterus, as well as apart from that, her BMI is 26. So with view of this, how do you go about further investigating her?
From her history and the investigations, from the history and her examination, first, as she's severely dehydrated, here first I would like to send her some bedside investigations to look for any signs of dehydration, urine ketones, and also the complete blood count to look for any anemia and also any signs of infection. Then I would like to send her blood group and even the liver function tests and the renal function tests to look for any signs of urinary tract urine for the ketones and the proteins, and the renal and liver function tests. Then I would like to arrange an ultrasound for her to look for location of pregnancy and what type of pregnancy it is. Is it a normal intrauterine pregnancy or a twin or a molar pregnancy? And also the also the beta HCG values, because that can be high in the molar and twin pregnancy.
Yeah. Okay. So the thing is like when actually you did the bedside test, the urine microscopy is normal, urine ketonuria is 2 plus, and her full blood count, LFTs and electrolytes, RFTs are normal, and you've got a scan done. So look into the scan and let me know what's your diagnosis.
As she's having her urine ketones has come to plus, and coming to the scan shows a molar pregnancy. Mostly it will be a complete mole, but the histopathology will differentiate it from the complete and partial mole. So it is a molar pregnancy, and yes.
Okay, so how would you proceed for her managing this patient?
So first, I would like to admit this patient, and then I would like to, as she's severely dehydrated and has severity on the puke score of 13. So here I would like to start her on antiemetics and the IV fluids to treat her dehydration, and then would like to inform my the multidisciplinary team, which will consist of my consultant and also the anesthesiologist, because the procedure will be suction and evacuation for her, and the specialist midwife and the blood bank. Uh, so further management will be depend upon the after explaining her the benefits and risks of the procedure, and it will be suction and evacuation under real-time ultrasound guidance.
Okay, then how do you go about after the procedure?
Yeah. So the procedure will be done under supervision of a senior consultant, because it carries a high risk of hemorrhage. So suction and evacuation under ultrasound guidance is done to decrease the risk of perforation and remove maximum blood clots, uh, maximum tissue. And if she is RH negative, I would like to give her anti-D 250 international units to her, and then the follow-up will be done under the GTD center in the Cork University, and would like to send the tissues for the histopathological examination to differentiate, which will differentiate it from the complete and the partial identiform mole.
Okay, and what about like any other advice you would want to give her?
Yeah. So here I would like to tell her that usually pregnancy is avoided until the follow-up is complete. So follow-up, if she is a case of a complete molar pregnancy, so for the follow-up will be like the beta SH values will be repeated weekly until they come to normal, and then monthly. So if they come to normal within 8 weeks of the procedure, suction and evacuation, the follow-up will be monthly till 6 months from the date of evacuation. But if they come normal after 8 weeks, so the follow-up will be monthly for 6 months from the date of normalization of the values. If it is a partial mole, the values will be repeated weekly, and once they are normal, then the final sample will be repeated after 4 weeks apart, and then the follow-up is complete. Till that time, I would advise her not to get pregnant. Yes, and advise her contraception.
Okay, so what's your take on the contraception?
Yeah, so contraception, the FSRH guidelines recently tell that all the methods can be used in case of a molar pregnancy, except the intrauterine copper device, which is not recommended in case of high beta HCG levels. But if the beta HCG levels are decreasing, then under a specialist advice and with the recommendation of a GTD center, they can be considered.
Okay. Okay, so is there any other thing which you would want to add on to whatever you have said so far?
Yes, so in molar pregnancy, the no, it can be diagnosed basically on based on the symptoms, the clinical history, and the examination of the patient, and also by transvaginal ultrasound. Nowadays, the diagnosis is quite early, So follow-up is important, very important in the case of a molar pregnancy, and even like proper next pregnancy, the patient should be told that early booking and doing an early ultrasound is very important to rule out subsequent molar pregnancies.
Okay. Okay. Yes, Priya, thank you. Yes, I think Priya, you were quite systematic. You went on really well. Yes, the most important things in this is to think of the differential diagnosis, because this could be thyrotoxicosis, this could be simple hyperemesis, this could be twins, and this could be molar pregnancies as well. So very important to rule out all these things in the investigations. And when you come to the management part of it, obviously you spoke about everything, the suction evacuation and then registration and the contraception part. It's more specific to the OCPs you can give, and also VT risk assessments throughout and telling her about the recurrence. Okay, so I think that was a like a complete station. Yes, if you wish to add on anything.
Yes. So very important is history taking, so and to quantify the excessive vomiting according to the puke score. So that will definitely we can classify her management, and detailed history is important to rule out if it is a twins or a molar, and examination is also important. So uh, just remember that only histology can differentiate that from complete molar pregnancy and a partial molar pregnancy. So yes, suction evacuation is the treatment of choice, and the follow-up is very important in the case of molar pregnancy always. And in Ireland, it is done in the Cork University. So usually pregnancy is avoided during the follow-up period. And the please remember that in the next pregnancy, early booking and ultrasound is important in these cases.
Okay. Yes, so this is something which can be easily asked, and they keep on asking these tasks. So make sure, guys, to revise them, and do not forget to like, subscribe these channels. Thank you, Priya. Thank you so much.
Thank you so much.